Yep, there it is. Just came on one time.
What's up, Charles?
Nothing much. Good evening, Mel, on this beautiful Wednesday night.
Hump Day Wednesday, man.
Yeah, the 5th, Cinco de Mayo.
Is it Cinco de
Cinco,
Mayo?
yeah, May 5th today. Cinco de Mayo.
It's just another day for me. Just another day in paradise. It's Hump Day, though. I know that.
Oh, yeah. Yeah.
So yeah, it was a long day today. Holy moly! I'm so tired. Hope of course I get my cafe.
Yes.
Well, we got a great show for you guys tonight. For those of you that came on early, boom, share, stop COVID, hashtag, hashtag wear your mask, hashtag get vaccinated, hashtag be smart. But let's get this thing out tonight. We got our mayor, Derek Kawakami. We got our district health officer, Dr. Janet Berreman, on tonight to talk story. You know, Kauai has, again, 6 more cases today, all community spread, one child. And I know we got a bunch of viewers from all over the state, all over the country. So bear with us while we have a Kauai discussion tonight. But I think there's much to be said about how Kauai handled its cases. And I really don't care what anybody says. I don't care what anybody says. And I think Charlie agrees. We would not be here today if we were not back into safe travels. And I'm not going to listen to the lieutenant governor or anybody else who says the safe travels works because Kauai is the proof. Kauai is the living proof. Kauai is the experiment, real world, with no computer models, no mathematical calculations. We entered safe travels last year, we blew up. We shut down, we went down. We opened up last month, we blew up. I don't need computer models. I don't need any of that. It is what it is, guys. So anyway, we'll have some discussions tonight about all of that stuff and about the recent spikes, about the tier system. I mean, from what I read and what I heard on the news, it looks like we're headed for tier two, bro. On Thursday, if we don't get those numbers down, we may be into tier two. We'll hear the mayor explain what's going on, but that's just based on what I've read. So we'll see.
Well, you hit the nail on the head. We have a real time data comparison between then and now, and not once, but twice to show how it affected our community. Okay, that's one. And so there's a comparison between safe travel. So I think tonight my question will be posed in such a way that I want to be respectful and understanding because when we have a community spread, at what threshold does it pass from a travel related to a community spread? Because I understand you have no choice but to lean towards community spread if you can't track it back to a travel related situation, right?
Mhm.
But we know that it came in. And the reason why I want to know if it's travel related or not is because through the contact tracing was enough done to go find out where this traveler is roaming. Because apparently it was strong enough to plant a seed to start this infection, this line. It's like a family tree, right? It's this line that started, and from there it goes one, it affects two, two affects four, four affects 16, and out. And remember from day one, I always say when you contact trace, don't we work our way back, extrapolate backwards, and try to get to. Now I understand if you can't find a traveler because they're gone. I understand that 100%. But yet there's still some that still maybe on island that was affected by the traveler. But we're finding people from this range, and yet there's this gap right here that maybe there's still some here. Possibly they're over the incubation period. Who knows? I don't know. But yet I kind of would like to find out, how far, what is the threshold before it says, you know what, we give up, we have to go with community spread because we can't find the travel related, um, whatever you want to call it, a travel related key points to consider it travel related.
Well,
Hmm.
let me try to put out this analogy here. If your neighbor's dog gets fleas and your neighbor's dog got loose and came into your yard and played with your dog, now your dog got fleas. So your dog,
No, no, that's not going to work because I have a cat. So that
well,
scenario is gone already.
so your dog got the fleas from your neighbor's dog. The neighbor's dog would be like the visitor. Now your dog plays with your other dog, and that dog gets the fleas.
Hmm.
We know that the fleas came from your neighbor's dog. That's how we got the fleas. Because your dog, your four dogs never have fleas. And your four dogs that play with your other neighbor's dogs never had fleas. So your left side neighbor dog had the fleas. But so your dog, your first dog, you can attribute the fleas to your number one neighbor dog. But all the other dogs are attributing the fleas to your dog. So no longer is it, but we all know, if not for your neighbor's, your first neighbor's dog, there would be no flea problem. That's the same thing with this COVID. The tourist brought them, or the visitor. I shouldn't say tourist. I should say the traveler. I misspoke. The traveler brought it and passed it off to a resident or a non-traveler, and everyone that that person came in contact with is being counted as a community. But we all know, we
Well,
all know.
I guess sometimes I wish I didn't have that investigator mind because aren't we trained to go and root out all the possibilities before we say, okay, we worked it as much as possible? Weren't we trained that way? And maybe that's why we're not contact tracers, because we will be rooting out every little nook and cranny.
Yeah.
Because I think it's important to know. I think it's important to know because this is what I would ask. If I were to find that traveler, right? If it leads me back to a traveler, then I can ask, where are you from? Oh, I'm from California. Okay. Then let's look if you got the California variant in there. So many things is possible. But when you don't have that body, you cannot ask that kind of questions,
Yep.
right? Like, if you came from California, did you were you an international traveler before coming to Kauai? Did you international travel into the US, went to California, then come to Kauai? Or what is it? Well, we don't have that ability. We've lost that ability. And I think that's important.
Absolutely. All right, let's bring in our guests, Mayor Derek Kawakami, Dr. Janet Berreman. There's Dr.
Yep,
Berreman.
yep.
Oh, there's the mayor. What? Are you eating Doritos with a fork?
They put chili inside.
A
Usually
chopstick?
with chopsticks. And I was eating chips with chopsticks pre-pandemic.
That's pretty cool.
I don't
Yeah,
want to get orange fingers.
you taught me that trick, Mayor. I like it.
Well, I don't have a bag of chips, but if I did, I would show you how I eat my chips without getting my fingers dirty. And it's very simple. You just pull them out and let them fall out of the bag, and it works. It works extremely well. But anyway, thank you both. Let me just put this up real quick. Guys, right now is the time. Hit the share button. Hashtag stop COVID. Hashtag get your vaccine. Hashtag wear your mask. Hashtag be smart. Anyway,
Yeah, corned beef hash and all the other hash. Yep, there you go.
yeah, I expect a lot of people on tonight. Well, thank you both for joining us tonight. I know it's been one hell of a week or so for both of you and your team, and we appreciate you guys taking the time to join us tonight. So welcome and thanks for coming back on. I don't even know where to start, to be honest, because there's just so much to talk about in so little time. But who wants to go first, Mary? You want to go first and give us a little overview of what's happening, or Dr. Berreman?
Yeah, I'm sure. I'll go first. And just to clarify for everybody, the share that Mel and Uncle Charlie was talking about was to share the show, not COVID. So,
Yeah.
you know, a lot has happened, and this is a good indicator of how quickly this virus can spread. It's very sneaky and it's very patient. These are the characteristics of COVID-19 that the public health experts have identified from day one, right? They said it's a fairly long incubation period, and it's sneaky because a large portion of our population can carry it with very little to no symptoms. But when it hits, it can hit particularly very hard. And, you know, we've seen it happen in other places. And Kauai has been fortunate that although we've been hit, we definitely haven't been hit as hard as other places have experienced. And you may run into people that have come from areas that have been hit hard, and they have a different perspective of the virus that many of us may have here on Kauai. And it's the nature. You know, it's human nature that until it impacts us directly, many people will not understand it. And I understand this. And I think the biggest thing that's on the top of people's mind is the shift to tier 3, some of the adjustments that we made, and we can have a conversation about that. We shifted to tier 3 because the numbers have gotten to a point where we've reached a level of concern, serious concern, that something needs to happen on a policy scale to be able to assist the district health office, all of our hospitals, nurses, our community members, the businesses, to help slow things down, get this curve flattened out so that we can get back to tier 4 and eventually, and I'll hint towards it right now, get to a tier 5 and a tier 6, which our IMT is working on. Now, some of the biggest changes that we've made to tier 3 and some of the comments I've heard is it doesn't look like much has happened. Well, it may seem like much may not have happened in tier 3. The fact is much has happened since October when we created these tiers to where we are today. And we needed to modernize tier 3 and the rest of the tiers to better reflect the situation that we are dealing with in this day and age. When we created tier 3, there was no vaccine. You know, we were still learning a lot about COVID-19. And if you take a look at the old tier 3, I think that what I'm saying really shows itself as far as what we had put down on paper back then. We were able to identify transmission in indoor settings, and Dr. Berreman will speak more about some of the findings with the district health office through their investigation. But any adjustments in tier 3 accurately reflect where we have a level of concern that if we continue to let people think that these are activities that don't have a risk, we could end up in dire straits at some point in time. And so we had to intervene. We have done things like restrict indoor gatherings from 10 to 5 because, again, it's riskier, but we kept the outdoor gathering size the same because we want to encourage people and send the signal that if you're going to get together, there are things that need to happen and can happen to make the get-togethers fairly safe. There's a level of risk with everything that we do, but fairly safe. And that would include all the things we talked about. Let's wear a mask. Let's be outdoors where there's good ventilation and good circulation. These are all things that can lessen the ability for this virus to transmit from person to person. We took a look at indoor restaurants, and the restaurant industry, the business industry has been just hit so hard by this virus. And what we were able to gather is that restaurants need to be able to and should be able to operate at the current capacity, but we're asking them to separate these larger groups into smaller groups. So if you have 12 friends, while you'd be able to all sit at the same table in tier 4, we're asking restaurants and customers to understand that you can still have dinner together, but we're asking you to have it in smaller groups. And this is all to help mitigate the spread and also to balance the workload that our limited labor force in the district health office and the county of Kauai have to be able to respond to the sharp rise in cases that we're facing. We took a look at team sports. Previously in tier 3, we had said, no, we don't see any evidence of community transmission in youth sports. Many of the leagues have submitted their safety plans, and if they implement and follow the safety plans that they provided, which they have, it's good for kids to be able to have physical activity. And it's also good for them to be able to have their parents be able to watch their child play. But I will tell you this, that based on our observations, and we have used discretion when we could, because look, we were at a level where we had 0 cases, 1 case, 2 case, right? Spectators need to understand that go watch your child play the outdoor sport, but the time to start being more disciplined with separating some space between you and other spectators that don't live under the same roof would be now. The time to have to think about, hey, you know what, things are different here. Let's get our masks back on. Let's be disciplined. Would be now as well. So I'll end with that because based on some of the questions that I've been receiving, that seems to be the ones that come up over and over again, and that seems to be where the common denominator is. And I wanted to give Dr. B some time to be able to further expand on what we were doing.
Yeah, thank you, Mayor. I know we have a lot of questions about the tier system and a lot of concerns. But Dr. B, if we could take a step back and maybe bring us up to speed on how this last spike occurred. What do we know as of now? What's going on? And we know now today we had 6 more cases. Is all community spread. But maybe you can bring us up to speed on COVID since a couple weeks now.
Thanks. I mean, the mayor does a really good job and he has such a good understanding of the situation. Of course, the major change that we made here on Kauai in the last month is that we rejoined safe travels at the beginning of April on the 5th. And we know that the incubation period for this disease is about 2 weeks. So we expected that starting 2 weeks after April 5th, when it was easier for our residents to travel as well as for visitors to come here, we would likely see an increase in disease. I will say that the rapidity of that increase and the size of that increase has been rather breathtaking. I certainly expected we would see more disease, but I did not expect we would see so much so rapidly. Starting on April 19th, we just saw this dramatic increase. And between April 19th and April 29th, 10 days, Kauai went from having for the last year had the lowest rate of disease on our island on a per population basis to having the highest rate of any of the counties in the state. So to go from best to worst in 10 days is pretty impressive. And what we saw during that time was not that we were seeing a lot of cases among visitors. We did initially see a fair number of travel-related cases, but even those were mostly among our own residents who had traveled and returned back home. And as time has gone on since then, we are now seeing the vast majority of our cases are residents, and the majority of them are community acquired. So the other big change we've made is that we've gone not only from having almost no disease, but from having no sustained community transmission to having that be the dominant disease that we're seeing is spread in our community. So, you know, we were very, very fortunate over the last year, thanks to the hard work of everyone in our community, not to experience the kind of dramatic disease spread and rapid community spread that the rest of the state and the country and pretty much the rest of the world has experienced. And now we've really been hit with that experience that others have felt as well. Fortunately, we are in a stronger position in some ways. We have done very well with vaccination. We aren't well enough vaccinated yet to have herd immunity, but particularly among our kupuna, who are the most vulnerable, the most likely to wind up in the hospital, we have a very high vaccination rate on the island. We also have a really good infrastructure. We've trained a lot of people. We have a lot of experience. We know how to do our contact tracing, our case investigation, our isolating, our quarantining, and our hospital infrastructure is small but sound as well. So we are reasonably well positioned to handle this surge. The challenge for us is that we're experiencing our surge at the same time as the variants are the dominant variety of this virus circulating. And we know that they are more highly transmissible. We don't have testing results back yet from the last couple of weeks here on Kauai, but certainly the rapid spread that we're seeing and the spread to many, many people in households makes us assume that we're seeing the variants here as we did at the end of last month and as is being seen in the rest of the state and the country.
Dr. Berreman, you know, it's not a hidden secret. We had a guest on one night that shared her experience. And because of that, it created this, I guess, mass testing from what she had said. If she wouldn't have said anything, do you think we would have been able to spot some of these cases that just, the influx of cases that came in one time? Because it seemed like it was pretty around the same time when she was kind of explaining her case, or is it totally different? All the cases were totally different.
Well, I have to confess, I didn't listen to that show. I heard a lot about it. But there was a lot going on in the health department, in the county, in our public communications, in our testing, our screening, our surveillance, our work with healthcare providers. So I think that all of these things contribute. I wouldn't claim sole credit for the increase in testing. I don't think that one caller, even with all of your listeners on your show, can claim sole credit for that either. I think that the community has really stepped up and responded to the fact that we have seen this massive increase in cases. And we saw this increase in cases before we were testing 300 to 400 people a day. That's really what led to the 300 to 400 people a day being tested. And that's a good thing. I'm glad that people are being tested. And that's another way in which our capacity is much, much stronger than it was last fall. We wouldn't have been able to do that last October, and we could turn it around on a dime now.
I think I like the way you put it. We're in a much better position, much stronger position now. The fact that we have much more testing capacity, we have much more vaccinated, but we had no vaccinated people back then. So I like the way you put it. You know, we are in a much stronger position here. And do we know how many of, I thought I heard you on the news mention about vaccinated, how many of all the positive cases that we had? Did you mention a number that was vaccinated?
You know, a while back I did. That was when we had many fewer cases than we have now. I have to say, Mel, I don't actually know that number now, but I've been talking about it with Dr. Kemble. And actually before this, I was just listening to a Centers for Disease Control webinar for local health officials about this. And we know that as we vaccinate more and more people, more and more of our cases will occur in vaccinated people because we have more vaccinated people. But the majority, the vast majority of our cases continue to be unvaccinated people. We're mostly seeing illness in young adults who would be eligible for vaccination but have not been vaccinated, and then in children who are too young to be vaccinated. but we are seeing some of those breakthrough cases. We know the vaccines are not 100%, but they're very effective. And we also know that they're extremely effective in preventing severe disease and hospitalization and death. So even when we are seeing illness in vaccinated people, it's either asymptomatic or very mild.
Yeah, and I'd like to add, I guess it's because I read the updates so regularly, but yeah, at some point in time, when we had 70 somewhat active cases, there were 4 individuals who became ill with COVID-19 that were fully vaccinated. And in those 4 cases, 2 of them absolutely had no symptoms. And then the other 2 had very mild symptoms. And that's always, that's always something that we look at as optimistic, because it shows that, okay, this vaccine is giving us a coat of armor to be able to handle the onslaught of this virus as it starts to move through our community. And I want to know, for the guests that came on the show, and then for the other individuals and the businesses that have stepped out to say, hey, you know what, I got tested, I'm COVID positive. Hey, this is where I work. If you guys ran into me, you should go get a test. I want to thank them, because there is medical privacy laws that is very sensitive, and the whole investigation process is very time consuming and labor intensive. It may sound easy, and I wouldn't know how to do it, but I do know from what was explained to me that it's a science behind contact tracing. And these individuals and businesses like Rob's, who came out to say, we're gonna close down, we're gonna deep clean, we're gonna send all our employees to get tested. For the people that have come out to say, hey, you know what, hey, somebody that was around me or myself got sick, it's brave. It's very courageous, but their courageousness has definitely helped this whole entire island. I got to tell you, like even when people have a flu, right? Pre-pandemic, you ask somebody that's working with you, like, hey, brother, you sick? They're like, oh, no, and they're sweating and their nose is running. They definitely got a cough. So I want to personally thank these individuals that have said, hey, you know what, I'm going to do the right thing. Thank you very much.
Real quick, and I don't know about today's cases, but we have had no hospitalizations with this last surge, right?
That's correct. Knock on wood, I would say.
Well, I think, it just goes to show that the vaccine is working, that in fact, the vaccines, and a lot of people are still on the fence, but, that it's clear to me and many others that because of the level of vaccination that Kauai has, thanks to the work that you all did and are doing, we've really minimized the illness and definitely prevented any hospitalizations and deaths. So, I think it's a good thing. And I think this is the proof. This is a real world experiment that happened. And I think people gotta really take that to account, that it does work. And we need to get everybody, as many people vaccinated as possible.
I totally agree with you, Mel, obviously, that we need to get as many people vaccinated as possible. And I do think that things would look a lot worse here now if, over the last two to 3 weeks, if we hadn't had as many people vaccinated as we do. It's also important that we continue to take all of those other precautions, because we aren't at a level of herd immunity. And we know that there are many, many unvaccinated people among us as we go about our daily activities. So it's also important that people continue to wear masks when they're around people that they don't know, or they don't have any way of knowing whether everybody's vaccinated, when they're in crowded places, if they need to be in crowded places, all of those things. So I want us to balance. Yes, it's helping, and we're not out of the woods quite yet.
Dr. Berreman, a couple of days ago, on one of the major news networks, they released a statement from several of the experts that now say that herd immunity may not be obtainable. Is that, when that statement was made, was that speaking for the entire US? But I guess what you're saying is Kauai, because of the percentage of vaccinations, will probably get to that point much quicker than other places, I guess.
Well, so I was asked the same question on the news too. Kauai likes to be the exception that proves the rule. So I'm certainly not going to say, if somebody says we can't ever do it, I'm not going to say, oh, well, we should give up on Kauai. I'm going to say we're going to try harder on Kauai. But I think that what that's based on is that for herd immunity, we're estimating that you probably need about 80% of your population vaccinated. And right now, vaccination is only available for people 16 and older. And the percent of the population that's younger than 16 is very close to 20%. So that would mean that we would have to have 100% vaccination of everyone who's eligible. And we know that that's not going to happen. Not everyone is going to choose to be vaccinated, and some people have medical reasons why they can't be. The fact that it looks like the Pfizer vaccine is likely to be approved for 12 to 15-year-olds, and that we don't actually know exactly where herd immunity sits, makes me think that we really shouldn't give up, but we really do have to try very hard. It really is the case that every single person who's vaccinated makes a difference for our whole community, not just for themselves.
Okay, thank you.
I've heard from several on the news from different people that in fact the level of herd immunity is actually up to 90 because of the variants, and so that, there's a lot of different information out there, but the fact is that it's going to be very difficult to reach that herd immunity, the absolute herd immunity. But like you said, it doesn't mean we stop trying. I think we keep on going.
I'll give you a layman's perspective. Oh, sorry, Dr. B, but like from a non-public health medical expert, right? The average bear, which would be me, look, I'm very optimistic. I tend to try not to take a look at the percentage of the population that needs to get immunized to get to that, what they call herd immunity, because the number has changed, right? It went from 70 to 80 to 90. What I look at is I'm very optimistic at the science, the technology, and the speed of the science and technology. And then every day is optimistic because every day more and more people, right, hit that second week where they're fully vaccinated. And then you have a whole bunch of people working on medication to help make sure that people can get a good full recovery. And every day they're learning more about the virus. And all of society is learning more about it. And the thing is, the whole world is racing to a solution. And I want people to take a look at the situation holistically and not get buried too much in looking at things in silos, because we want people to remain hopeful. I am very hopeful. I have an optimistic view on where we're at today and where we're headed. And even though we're facing some adversity now, I can tell you there's organizations out there that have let us know, hey, you know what, I'm making the call. We're gonna postpone our season. Drug court was gonna have their graduation, and Mel, drug court is near and dear to your heart. You've been a part of it. You're part of that foundation. They said, hey, you know what, we're gonna forego that in-person graduation. Can you do a video? People's own personal behavior has changed before the tier system came up, right? And this is what we want to see is, from government, we create the plan, we execute the plan, we triage the situation, we control the situation, and we say, look, these things work, follow us, and then it becomes common practice. And more, we're very optimistic that we're seeing this change happen. And I try to see like where we are on a big picture scale to where we're at, yesterday, 2 months ago. And because herd immunity is just, it seems like, and I was so focused on that too, right, for a while. But let's face it, a lot of people are hesitant to get the vaccine for their own personal reasons. And I gotta respect that. We all gotta respect that. But more and more people are also saying, hey, I saw my cousin, my mom, my brother get it, my coworkers, and they make that personal choice to make that decision. And so all of these things make me very optimistic that we're going to be headed towards better days, and we are.
I mean, I agree. I mean, I think the development of the remedies and all this stuff is going to happen in the future, and we're going to have to rely on, all of the available resources to kick this thing. I kind of wanted to shift. Charles, you had another question on that?
Yeah, I wanted to ask the last question, I guess, for this segment, and this is posed to Dr. Berreman, is trying to understand the travel related as opposed to the community acquired. Are we capable enough to be handling both? Like saying, I'm looking from the standpoint, and maybe this is naive of me, to try to hold off travel related, not letting any more back in, just deal with what we have now in the community until we can snuff it out, or get it to the point where the community is almost snuffed out, and yet something may come in travel related, but we might not be that close to detect it was travel related, other than it was planted in the community and never found where it came from. Then it starts that community acquired again when actually we know it came from. So, are we in a position that we can actually handle both? Or do we try to say, maybe, because I think we've seen in a real time sense that when we opted out, we kept things pretty down and we opted back in. And maybe there's a coincidence on how things fluctuate, that we can maybe try to take care of one really good and really crush that hard, so that we buy enough time to, if something else should happen, we can focus on that as well.
Yeah, it's a really good question, Charlie, and I don't know the answer to that. I think from having seen my advice and my comments over the last year that I'm a cautious person in this setting, but I'm not a pessimistic person. And I, like the mayor, I'm optimistic now. I really do think that we have capacity to handle much more than we could have even 6 months ago. So, and I also am very aware that, opting out of safe travels came with an enormous cost to our island. So yes, it got disease under control, but it was a huge sacrifice for many, many of our residents. And I don't think we're in a place where we need to make a change to our travel requirements. Sorry. I do think we can handle both. And if we look at what's been going on in the other islands, they have managed a relatively low level of travel and a relatively high level of community transmission on top of that. My hope and my goal is that we can keep that community transmission under wraps at a low level and handle it in addition to the trickle of travel cases. And we really are only seeing a trickle of travel related cases right now. But because of the variants, when we do get a travel related case, we're seeing a lot more and more rapid spread into the community. And then we see the community transmission. So that's my hope. And I'm optimistic that we can do that. But my crystal ball, as I've said, is always kind of fuzzy, and I don't know. But that's the advice I'm giving the mayor. And that's the way we're going, is relying on all of the skills and experience and capacity that we've developed over the last year, which is not just county and state staff and government. It's also all of our residents who have become very adept at wearing masks and keeping distance and staying home when they're sick and avoiding large gatherings. People know what to do. And the fact that we're seeing people voluntarily step up and do the right thing is another reason for optimism.
That's a great segue into the next segment that I wanted to cover. So Dr. Berreman, you and your team, the Department of Health, you guys focus on the medical side. You guys tackle this difficult, it's tough, man. And then Mayor, you on the county side, policymakers, how does this machine work together? How are these decisions being made to go from tier 4 to a modified tier 3? Or I saw in the news, and I don't know, I don't remember hearing you say it in any of the interviews, but I read it in one of the articles that we may be headed for tier 2 on Thursday if the numbers don't change. I must have missed that interview with you, but how does this machine work? So we get Dr. Berreman and her crew doing their thing with the actual virus and the patients and all of that, and then the government side. How does this work? And you can take turns. I don't know how.
I gotta go check, but I don't think I said we're heading towards a tier 2, because look, one.
I didn't hear it. I didn't hear it at all.
I don't think I'd ever say that, because I don't want to go into a tier 2, and that's why we're in tier 3. so we can get this situation stabilized quickly, and that's going to require some people to respond. But back to the question as far as how the whole decision-making process works, it's really a work of science and art, but it all falls back on the basis of disaster response, disaster mitigation, and disaster management. And under the Koi Emergency Management Agency that's led by Elton Oshio and Chelsea Sakai, we activate that EOC for every disaster. Mel, you have been deep and involved in that process. And what we do is we activate what we call the incident management team. So we bring in the subject matter experts, and our incident management team has been activated for over a year, from before the pandemic even had the first case on Kauai. And so we create these branches where we have a branch chief designated. One of the unified commanders in the incident management team is your very own Dr. Janet Berreman, as well as Solomon Konoho from Kauai Fire Department. We have like an operations branch chief and a co-chief, which would be Patrick Porter, who's a Parks and Rec director. But before that, he came from the state of Hawaii in forestry, and he has a wealth of knowledge as far as responding to disasters of all sorts, as well as Lauren Guest. And then we go into logistics, planning. You talk about leaving no stone unturned when we bring in what I would consider the A team to help give me guidance to make that executive level decision. And that's really what it's all about. It's really a decentralized command, meaning when you have a disaster, the worst person to be leading is a micromanager and somebody that cannot make a decision. Those are two characteristics of people that tend to not do well if they're at the shot calling level where they got to make a decision. A micromanager will intervene too much and into the weeds to let their teams go out there, do the work, come back with a recommendation, have a robust discussion. And somebody that can't make a decision will spin in circles like a top and let things burn out of control before somebody's got to step in, pull them out of the room, and say, hey, we got to take this thing over. So we got a great team. We have a robust discussion. And when I say decentralized command, that doesn't mean that I click my heels up and say, I'm on cruise control, gang, go get it. What it means is I give the team the latitude, and I have the confidence in the team and the process, the time and proven process that we have, that these branches will go out, they will collect information, they will come back, they know exactly who they need to collaborate with, they know exactly who in the field and in the community they can tap into as far as a resource. And then at the end of the day, on Mondays, we have what we call our rules discussion. We take a temperature check of every single branch chief and everybody in the room as to how they're feeling about the tier system. How do you feel about safe travels? And we got a checklist of things that would consume probably 2 hours of our time. And then we formulate these rules where we feel this is the best path forward based on the information that we do have and the information that we don't have. Is it a perfect science? It's not. Is it designed to be a perfect science? It's not. Like I said, there's a lot of art and science that goes behind the whole process of how the IMT makes decisions and how they get information up to me to be able to make an executive level decision. Do we come to 100% consensus? Absolutely not. And that is not what the IMT is designed to do. It's designed to create checks and balances and a questioning of the process at each turn of the way. And I can tell you, the conversations get heated at times, but at the end of the day, they're all professionals, right? Then nobody takes it personal because it's business. We come together and we come with the best plan that we possibly can. Do I second guess decisions? All the time. And I can tell you, I want leaders that are above me to second guess their decisions as well, because what that tells me is that they're questioning the process, that they're putting deep thought into it. But at what point does second guessing become micromanaging or an inability to make a decision, right? And that's really, like, in a nutshell, a Cliff's Notes version, sort of what goes on behind that EOC. on a daily basis. And some of these guys work around the clock. And it's, oh gosh, it's complicated, but it's beautiful. As a leader, as a manager, to see the process take place, to see the energy that our branch chiefs and the whole team has, and has been able to hold on to from beginning up until now, and to see the morale, the good morale that's in that building and in that process, look, Kauai, you should be very proud of your incident management team. In fact, I think at some point I got to get them in front of the camera to introduce who the branch chiefs are, because quite frankly, you folks would be surprised. You're going to probably see your son's football coach. You're going to see your next door neighbor. These are people that on an everyday level, they're just like us, but they come with a skill set and a leadership set that makes them primed to be able to deal with disasters over a prolonged period of time. Sorry.
Dr. Berreman, is he telling the truth?
He is. I was going to say, the fact that the mayor can articulate that complex, multi-layered decision-making and disaster management process as clearly as he can, and as succinctly as he can, that's the reason that Kauai has been able to be as successful as we've been. It requires teamwork. No one sector can do this by itself. And when the various sectors are fighting for each other, or there are turf wars, or there's not trust, that just makes the work all that much harder. And the mayor and his team have really created an environment in which we can share honest differences of opinion. Each of us has had the experience of learning from someone else and changing our minds and being wrong. And we all do that professionally and with humility and good humor. And it's a remarkable thing to see and to be part of, and it's an honor.
Well, we talk about it almost every night, I think, Charlie and I, every night we're on the air, that, you know, we're blessed to be on an island or in a county that is very transparent. I think one of the things that I noticed that's clearly different from Kauai is the transparency with the public. And it doesn't seem, or it doesn't appear like in some other jurisdictions that there's a conflict, a political conflict. You know, I think all from what I've seen on Kauai, everything is based on the health and safety of our people. And I think we really appreciate that. And I would thank you both and your teams. I would love to do a show with all of these guys, Mayor, and showcase them to the public, because you're right. There's so many people that are doing additional duties that were called upon and, you know, had their train tracks diverted to fulfill the mission. So, and the public doesn't know who they are. So that would be awesome. That would be awesome.
Dr. Berreman.
Real quick. Oh, go ahead, Charlie.
Yeah, I wanted to ask, how can we, what kind of messaging do you think can be made, especially to those who, you know, one question was brought up a couple of nights back that, you know, sometimes they believe someone feels they're kind of a little under the weather, but they still report to work, and they you know, they may have the virus. What kind of messaging can you get out there to people to tell them that, you know, got to really take it serious? I mean, that's all we've been promoting, that, you know, if you feel a little bit under the weather, please do not, you know, just, you know, I don't want to say, you know, just assume you have it, but, you know, you got to use some kind of caution. You got to blow caution in the wind there. So I'm just wondering, what kind of messaging would you kind of give the people out there?
You know, I guess I would give examples that we have had people who were feeling unwell, even people who had traveled to the mainland and started feeling unwell when they came back, but felt like their work was important. They had family obligations. They had, you know, they needed to buck up and keep doing what needs to be done, as all of us have done in our lives. And then as they continued to feel sicker and sicker and ultimately got tested, then they were in the position of, talking to a contact tracer for a long period of time and saying, yes, I went to work each day for the last 5 days while I was feeling sicker and sicker. And then all of the people who were in the workplace also need to be notified that they've been exposed. They need to be quarantined for 10 days. They need to be tested. So all of those people have been put at risk. And frankly, I think that the individuals who've gone to work and been in that situation have some regret about having exposed their colleagues, coworkers in that way. And I know that none of us thinks that it's going to be us, but especially with the disease spreading the way it is in our community, unfortunately, it can be any one of us. So the better thing to do is to stay home and see, do you feel better in 24 hours? Do you want to, talk to your doctor? Should you get tested? And it's also on employers and on each of us to, support that kind of behavior in many of our colleagues, because we may be used to saying, oh, they're staying home because they have the sniffles or something, but that's the kind of behavior that we should be encouraging now rather than discouraging.
One last question. Had the mute button on, but with regards to, I know sometimes someone will test positive, and yet there's still no way of quantifying what that means, whether they're at the tail end of their cycle or they're at the mid, because it's when they go and get tested, and because the PCR test is so sensitive that it could be like minute traces popping up and showing positive. And I think that when it hits the release, everyone kind of looks at it, oh, the person's sick. Well, they may not be sick. It's almost like asymptomatic, right? You get traces of it, you pop up positive. So I guess my question is, there is really no way of quantifying how positive is positive, right?
No, not routinely. I mean, there are research methods of doing that, but you're asking about two different things, because you can have asymptomatic infection and a lot of virus. You
Right.
can also be, as you say, at the end of an illness and have very little virus. We do, have criteria. Part of the case investigation is exploring if people felt sick, how long before the test they felt sick. And sometimes we use the date of the test as the start of the isolation period if we really can't tell when they got sick or got infected. But if they have symptoms that started several days before that, then that's what we use as the starting time. And that's where it's partly art and partly science.
Well, the reason why I asked it is, when the information is released and we, the general public get to see that, so many people are infected, we don't know what you just explained, if it's at the tail end or if it's, because again, I know you didn't see the show, but the individual, and I'm trying to replay that, how it was said, and maybe there, I might have heard it wrong, but Mel, correct me, is being infected, but at the tail end of the cycle, are they still able to get out of that isolation if they test positive? Because there's no real way of saying how bad it is, right?
If you test positive, you need to serve an isolation period that is consistent with the CDC guidelines, which is at least 10 days from either the onset of your symptoms or the date of your test, whichever one was first. So that actually is a reason, if you're feeling sick, to go ahead and be tested. Because if you feel sick and you wait 3 weeks to get tested and you're positive then you're more likely to have to do more days of isolation then, because we can't definitively connect that positive result to whatever it was you felt 3 weeks ago.
And stay home.
Well, yes.
When you're sick, you stay home.
Thank you.
Real quick question.
You can leave home to go to the doctor and get tested.
Absolutely. Real quick question. This came up a little while ago. It was about, does the vaccine affect mammogram results? Sorry to spring that up, but.
Oh, The vaccine can cause lymph node swelling, which can show up in a mammogram. So there are new recommendations about timing. Either get your mammogram before you get your vaccine if you're due for a mammogram, or there's a recommended timing from after you get the vaccine to when you get your mammogram. And I don't have that number on the top of my tip of my tongue.
Thank you, thank you. And then we only got about 15 minutes left. I did want to go back to the tier system and deal with some of the questions. Maui is doing a second or a post-arrival test. Mayor, I know, again, with the numbers that we're seeing, no hospitalizations, no deaths, obviously, thank God. So I think, Dr. Berreman, as you mentioned, what we're seeing right now, we can manage at this point, and there would really be no need. Do you see us, if this continues or increases, do you see us possibly doing a post-arrival test at some
No,
point?
I mean, I think Dr. Berreman would give me guidance on whether it makes sense to have a test done upon arrival. Right now, and you know, these tests are expensive, right? And there's, you know, even though we have more, it's still something that we don't want to burn through if we feel that it's not being utilized in a way that will get the best results for the public health challenge that we're facing. You know, the thing about some of the information that we receive is that, you know, early on, I think it was either HLTA or the Hawaii Tourism Authority did sort of like a temperature check on mainland travelers on what the level of comfort was traveling during a pandemic. And some of the results that came back is as the vaccine was being developed and slowly getting out into communities, a lot of the travelers themselves have said, you know, we're postponing our travel until we can receive our vaccine and become fully vaccinated, because a lot of people that travel, like me, like to travel so we can relax. And it's sort of hard to relax when you're traveling and you got to worry about getting sick and being stuck somewhere, right, in quarantine. But what we're doing is we try our best to capture data from other places that are doing post-arrival tests to be able to extract data such as how many passengers are getting off in Maui that are fully vaccinated, that don't need to take a second test. So, you know, in a sense, it's sort of like what's happening on Maui is a pilot to show us results of what we could probably pragmatically determine that we would be similar, would see similar behaviors. And so we have thought about it. It doesn't make sense right now, just because under safe travels, people are taking a test 72 hours before flying, and then to immediately take another test upon arrival doesn't give you that length of time that would really make sense, I think, to burn through those many tests to catch what we're trying to catch. And then Governor Ige had made it clear that, you know, post-arrival testing programs outside of safe travels would be a cost that would be the county's responsibility. And we just don't have that kind of resources to burn on that sort of testing. So I can't say that it would never happen. I just think that our incident management team as a team has determined that that wouldn't be the best use of resources. The best use of testing right now is the way it's being utilized to try to slow down the community transmission, which is our biggest concern at this point in time.
Yeah, I mean, 3,000 arrivals a day. I would agree that the test upon arrival, I think what the arrival testing that they're doing in Maui is probably not very effective because of that incubation period or whatever, latency or whatever you want to call it. And there's really no way you can require, how do you get a tourist, or I shouldn't say tourist, traveler, to come back and get a test 3 days later, unless you have them in a quarantine place. So but that could get pricey. And I, and that's the one thing that I disagree. I like, Governor Ige has stood up for, I think recently, for the safety of the people with some of his comments. But the one thing that I completely disagree is the fact that we cannot charge the tourists for the test. I think that to me was not a very good thing, but it is what it is. That's the rule. And that's just unfortunate. So Maui's paying for their tests and they're doing it upon arrival like Big Island did, right?
From what I understand, but Big Island also had a generous donor that I think initially had paid for a whole bunch of tests. And we have our own donors that have contributed, to our community, and we have partnered, with to be able to get a mobile testing lab that could possibly also be a mobile vaccination clinic as well. That, from what I understand, is on the water, making its way over to Kauai, so that we can utilize that as a tool to be able to rapidly respond, and then also reach some of the communities that are harder to reach to, try to break down language barriers, cultural barriers. A lot of people may be hesitant to come in and take a test, or maybe hesitant to take a vaccine, may have transportation issues. When you talk about like some of our population base out there that we're concerned about, our houseless community, they were one of the first groups that the Department of Health reached out to try and say, hey, we have vaccines available. We want to make sure that we protect you folks. And, so it's different everywhere based on what sort of resources sort of come our way as well.
Dr. Berreman, vaccines available. I understand now. We have a lot of vaccines available throughout the state. Actually, I'm seeing places now are allowing walk-ins to get rid of some, that's a horrible way to say it. But to get the vaccinations out, the supply is there now. For those that are watching right now that would like to go get a vaccine, what's the options now? I know they're doing some free or some clinics out in Anahola, but generally speaking, where can they go?
Well, generally speaking, they can check the county's website, kauai.gov/vaccine, for up-to-date detailed information. There can be a lot to read through there, but you can find out everything you need to know about where you can get vaccine on this island. So that's the single, I would say, most reliable source of up-to-date information. But in general, all 3 hospitals are offering vaccine. Ho'ololahui is offering vaccine. The Kaiser Clinic in Lihue is offering vaccine, and you do not have to be a Kaiser member. It's for anyone. And then pharmacies around our island are offering vaccine. So Safeway pharmacies, Long's, the Walmart, and Costco. So there are lots and lots of options. The nice thing about having so many partners is some of those offer weekend hours, some of those offer evening hours. So there's really lots of flexibility in terms of time and type of location and geography.
So all of those all of your partners, all the pharmacies, that's all can be found at the kauai.gov/vaccine.
Mm-hmm.
Perfect. Thank you. One of the guys I work with was so against the vaccine up until last week, and with the recent spikes, and he made his appointment, so he's getting his shot on Monday. Kaiser is backed up pretty much, but he's getting his shot on Monday. So, I think more and more people are kind of leaning towards getting the vaccine. I know there's still a lot of people, and like you, Mayor, I respect those that choose not to, but I think this is a good example. This little crisis that we are going through, is clear that the vaccine helps. So hopefully more people will get vaccinated.
I too, Mel, have friends who are real public health proponents, but have been hesitant to get their vaccine. And the increase in cases has, I think, contributed to my friends changing their mind. And I won't call them out by name on this show, although I'm sorely tempted, but I know they have an appointment tomorrow morning at 11:15, and I'm going to be checking in on them.
And a lot of people, right? Like I got friends that just procrastinated, right? They're like, we're all good. intended to get one, right? But it's like, I'll do it tomorrow. Yeah, and we all do that. And then, for whatever which reason, in recent times they said, well, where can I get one? Like a lot of places. I mean, go to the website. Costco came online, right? I think they're doing Johnson and Johnson. A lot of people want the one and done. I went through, Costco's reservation system because I was trying to walk a friend through. It's simple. You know what I mean? You pick your time slot, you go in, and it's relatively easy. And everybody, right? When they're ready, if you're out there thinking about it, if you make the decision to get a vaccine, there's a lot of smiling faces waiting with open arms to get you that vaccine when you're ready for it.
I tell you, when I fainted, when I saw the needle, and when I came to, they were all smiling. When they picked me up, they were all smiling. Charlie was supposed to come hold my hand, but he didn't show up. So I
had a KCC student do mines. They're out there on the front line, getting the students out there to get practical experience. When I went in to get one, they said, "Hey, would you mind if a KCC student?" I said, go for it. I mean, there's a level of anytime there's a needle involved, right? I mean, most people don't look forward to it, but it's painless. Second shot, yeah, I got some body aches, but that's from what Dr. B tells me. That's my body recognizing what to recognize just in case, right? I get sick.
So Johnson and Johnson is back. I did have a few comments that were coming up tonight asking about the Johnson and Johnson. So Kauai.gov/vaccine, people. Johnson and Johnson is available on Kauai, so go check it out and go sign up tonight.
One of the questions that popped up, it kind of scrolled by fast. I was hoping you caught it, Mel. But anyway, someone asked about our schools. It looked like it was. Does it appear it was isolated, and does it look like there's a widespread?
Yeah, so there's actually really good news about schools. And I'm glad you asked, Charlie, because I think it's really important for people to know, because of the cases that we've seen since the first week in April, about a third have been children, people under 18. And that's many more young people than we had seen before. And those children, though, are getting infected by other adults in their homes. They are not getting infected at school. They are not getting infected on the school bus. So we've worked very closely with the Department of Education for every student in the schools, and actually with private schools and charter schools as well. And we have followed as close contacts about 100 individuals related to school and school bus related exposures. And we have not had a single case of disease transmission in one of those settings. So we haven't had any time where a student or a teacher or staff member spread COVID-19 to someone else in a school setting. We've had children or others that we know attended those settings while they were infectious, and we have followed the close contacts, quarantined them, tested them, and no one else has been infected as a result. And that is similar to what we've seen statewide and nationwide, that schools are doing a really good job of following safety practices, and they are a very low risk environment for our keiki, and that's where they should be.
Okay, thank you.
Thank you. A real quick question, Dr. Berreman, just popped up. Is our hospitals, do they have the capacity to treat someone that takes a vaccine that may get a serious reaction?
Yeah, they do. I mean, the kind of allergic reactions that people can get are serious, but that's exactly the sort of thing that even our EMTs, our ambulance crews, and emergency rooms are trained and equipped to handle.
Awesome. I know we're right about at 8 o'clock. Mayor, I had one question that was messaged me earlier because the person who you know very well, a good friend of ours, had a question about the churches. And I understand that there's some, and I told him I would ask the question, but there, Charlie and I, we get complaints regularly. And one of the constant complaints that I get are churches that are not participating or not being responsible. I guess there's some restrictions or some prohibitions for government to get involved. What would you tell our churches, our church leaders, our church goers? I mean, I don't want to be harsh on them, but I do want them to understand that everyone needs to be responsible.
My message to them would be to please continue to pray for this island, for for the people that have been hit financially, to pray for the people that are that are fearful, to pray for our IMT, to pray for the world right now. I think the world needs a whole bunch of prayers, that they that if to remember that that at the end of the day, forgiveness is what the reason why Jesus died on the cross, was to teach people about forgiveness. And that and there's a separation of church and state, and I understand that, and I respect that, and we would like them to really understand that at the end of the day, I think we're all trying to do the same thing, which is to save people. And there's ways that they can save people on a multitude of levels, through prayer, through guidance, for, being a family for somebody that doesn't feel like they have a family. And of course, by, giving good guidance for, leading people in the right way.
Thank you. Dr. Berreman, any closing thoughts for our viewers? And we got a ton of
I'd like to echo a little bit what the mayor said, which is that we're all in this together. We're a small community. And I want to say thank you to our residents and community members for all that you're doing. And also just ask people to remember that the Department of Health contact tracers and case investigators who call you and text you, they're your neighbors. They're the parents of people who go to school with your kids. They're the people who shop in the stores with you. And they're doing their job to protect all of us. They aren't here to blame you or shame you. They're here to help you protect your community, and just to ask people to meet us halfway, because this isn't work that any of us can do on our own. We depend on every single person in our community to be part of the solution. And I think it's because so many people have stepped up so much over the last year that we've done as well as we can. And again, that's why I'm optimistic that we will continue to do well. And of course, if you haven't been vaccinated and you're eligible, please do so.
Mayor?
Yeah, I just I want to thank you again. It felt like a big break since Dr. B and I have been able to come onto the show. We're going to get through this. We've hit a rough patch, but we have some confidence that we're going to be able to emerge through this, learn from this situation as well. Your team at the IMT is working tirelessly to be able to factor in other metrics to measure, such as hospitalization rate, vaccination rate, increasing capacity, in businesses, slowly as we emerge back to a life that we're used to living. Just stay strong. We're all in this together. If you see somebody that's that needs support and is a little down on their luck, and pick them up. If you need help, if you feel trapped, seek therapy, talk to somebody, go to our website, reach out to Teresa Koki at Life's Choices, call a friend, don't hold it in, because you're not alone, like we're in this together. So that's a message that we should be hopeful, we should be optimistic, we should be doing what we can to bring people together. And we're going to come through this stronger as ever, like Kauai does.
Thank you, sir. Charles?
Well, I'd like to thank our two guests tonight. Thank you so very much. I know it's been a while since we've had you on, but everything is based on timing. It's especially what we've experienced within these last couple of weeks, I think was very well worth it for the viewers to hear. And you put everything into context instead of the viewers having to go through the guessing game. Because sometimes, trying to navigate through these tumultuous times, you need as much help as you can. And so I want to thank our two guests for being that mouthpiece for tonight, and that helping us understand, what we're up against. So I mean, the battle's not over yet, but I think if we just do our part and I've said this to you earlier now. If we look back when there was flu, and even back then we didn't use masks, but now we use masks now, and this flu season kind of went right by without anything. I'm a believer. I'm gonna use a mask from now on because to me it works. And I never got sick this year, so I said, I think everybody got to kind of key in on that message, and that is, use whatever you can to help you through this. Don't go solo alone. And I know people have their rights; they don't want to get vaccine, but if it kind of tilts the scales to kind of better help you, then maybe that's something you might want to consider. But again, the choice is totally up to you. But most of all, thank you to our two guests tonight. Good job.
Thank you.
Thank you, Mayor. Thank you, Doc. Thank you to your team, all your team members. Sarah Blaine, again, catching up a lot of the questions on the post. Appreciate you, Sarah. She's always there for us, man. She comes in and she answers the questions before we ask them. And I really appreciate that. Saves so much time. There are tons of questions that we couldn't get to. I apologize, but I just enjoyed the discussion. Mayor, I really appreciate your plea to ask for prayer. Not too many politicians do that, but I appreciate, I respect that. We tell our people every night on our show, before you go, put your head on a pillow, say a prayer for everybody. Everybody's affected. Everybody's grieving. Everybody's just, guys. I posted the other day. Now is not the time to be getting upset and angry at each other. Now is the time to come together, just as if COVID was a hurricane, like we did after Iniki. Now is the time for that. So I really appreciate that, Mayor, and Dr. Berreman. You're always so articulate. I hope we got enough of your most of your questions answered, ladies and gentlemen. I hope you enjoyed it. We will definitely have this dynamic duo on later at some point. But until then, we'll see you guys on, what is today? Wednesday? We'll see you guys on Friday at 7 o'clock. You guys behave, be safe. Love you guys. Aloha.
Aloha.
Thank you.